Okay, this is a continuation of our lecture. So we're going to look at blood vessels now. Now on your notes, you have the cardiovascular system, a closed circulatory system of vessels containing blood. Now, you have a blank. Arteries. Arteries always carry blood away from the heart. Arteries are always carrying blood away from the heart. Veins always carry blood to the heart. The designation of arteries and veins does not really have anything to do with whether it's oxygenated or deoxygenated blood, because the respiratory system is, the pulmonary system is backwards to the rest of the body. The arteries contain deoxygenated blood and the veins contain oxygenated blood. So we've got to remember that the arteries always carry blood away from the heart, veins carry blood toward the heart. Now on your notes, you have a listing of like the aorta, arteries, arterioles. There should be an arrow between each one of those going from the aorta to the arteries, then from the arteries to the arterioles, arterioles to arterial capillaries to venous capillaries, then venules to veins, veins to vena cava, and vena cava to the atrium. That's showing a progressive drop in blood pressure from the aorta to the right atrium. So it has to go out the aorta to all the arteries, arterial capillary bed, venous capillary bed. So it's going to cross this capillary bed here in the middle, the picture here. Around 12 to 25 millimeters of mercury pressure here. Then it's going to return on the venous side. Now the venous side is a pooling side. Arteries have a pulse because the heart beats and the vessels swell and that blood's forced down through the arteries. But when you get to the capillary beds, that's going to diversify and spread the blood out. It's going to enter the capillary beds, and then as it leaves, it's going to pool into veins. Veins do not have a pulse. Now looking at a model here that we could look at, we can see parts just like we did on the previous slide. Arteries are composed of three tunics. Now this is the artery here, the vessel in the middle. You see how this model splits at the top. Those are vein on the left and a vein on the right, and the arteries in the middle. Well, the tunica interna, that means internal tunic, the internal layer here, tunica interna, consists of two parts. You see it's labeled simple squamous epithelium. Well, that's the endothelium. So simple squamous epithelium is the endothelium. E-N-D-O-T-H-E-L-I-U-M. It's the endothelial lining that's continuous throughout the entire cardiovascular system. A layer of elastic tissue called the internal elastic membrane. So it consists of two things. The simple squamous epithelium called the endothelial lining and the internal elastic membrane. The internal elastic membrane helps the arteries to recoil to force blood into the body. Remember when the right ventricle contracts, that sends blood to the lungs, but when the left ventricle contracts, that sends it out to the body. And the aorta is going to swell and then it's going to recoil. Well, the aorta has these two parts of its inner layer, the endothelial lining and the internal elastic membrane to help it recoil. Well, the next outer layer is the tunica media, and on an artery, the tunica media has two parts. That should be the external elastic membrane, not internal. It should be external elastic membrane and smooth muscle. And that smooth muscle is kind of thick. You can see it here in the profile. So it's smooth muscle and elastic fibers on that tunica and on your blanks. Smooth muscle is the first blank, and elastic fibers, which are the external elastic membrane. I'll have to fix that. These two components make the arteries very contractile. The smooth muscle has elastic fibers in it also, but it's thick and it gives it strength. And then the external elastic membrane, this woven pattern here of elastic fibers, gives it a lot of strength and support and recoil capability to force blood into the body. When we look at the tunica externa, it's just loose connective tissue, elastic and collagen fibers which hold this artery in place. Well, that's the artery. Let's look at the vein profile. We'll look at the next picture, will be a vein. Okay, these two outside vessels are veins, and so let's look at the tunica interna. Simple squamous epithelium. So the tunica interna is just endothelium. It's the endothelial lining, simple squamous epithelium. The tunica media is a thin layer of smooth muscle. It's thin, very thin compared to the artery. And the tunica externa is just loose connective tissue, which helps to secure the vein in place. So you see, remember, the arteries have to have the elastic membranes and the thicker smooth muscle because of the pressure in an artery. It expands and recoils, whereas veins is a pooling vessel, and so it doesn't have to have any elastic membranes in here. It's pooling and returning that blood to the heart. Here's a little cross section we would have had in lab you could have seen. You can see this dark purple squiggly line structure around the artery and the vein, not too much around the vein, but it is on the outside. That's going to be your tunica externa, the loose connective tissue and elastic fibers. Now look at the purple. It's thick on the artery. That's a thick tunica media. That's the smooth muscle. And the vein is somewhat thinner on this one. That's a large vein, so that's why it's so thick. But that's the smooth muscle. And then the inside lining of the vein is nice and smooth. But look at the artery. It's ripply, it's corrugated. Because when the artery recoils, the inside lining wrinkles. And then when the ventricles contract and force blood out, the arteries expand and they flatten out nice and smooth. But when they recoil, the inside lining is wrinkled. Since veins don't have a pulse, they're always smooth inside lining. Now, in your notes you have smooth muscle. Innervation by sympathetic nerve fibers cause a decrease in the diameter of the lumen. That's called vasoconstriction. V-A-S-O-C-O-N-S-T-R-I-C-T-I-O-N. It means constriction of the vessel, the blood vessel. Remove the sympathetic stimulation and the diameter of the lumen increases. Now I can think of, since when would these occur? Well, let's talk about digestion. When you're digesting food, you need a lot of blood flow to your digestive tract to support the cells and to absorb the nutrients into your body. But if you are in a fight or flight, you're exercising or running or something like that, you don't need to be digesting food. That blood needs to be diverted to your muscle and your brains. And so those vessels will be vasoconstricted to reduce blood flow to digesting the meal, while it's then sent to your blood, your brain, and your muscles to handle the problem, either of exercise or fleeing, protecting yourself. So that'd be one example I could think of. We have elastic or conducting fibers, conduct blood away from the heart to large size arteries. I gave you some of those that are called elastic or conducting. Aorta, the brachiocephalic artery, common carotid arteries, left and right, subclavian arteries, vertebral arteries, and the common iliac arteries are elastic or conducting. Those are large. Muscular or distributing arteries. Medium-sized arteries distribute blood to the body, so they're going to be branches off of the elastics. Axillary, that's going to your arm. Brachial, to your arm, upper arm. Radial to your forearm, it's on the left side, and then you have an ulnar on the right side. Intercostals between the ribs. Splenic go into the spleen. Mesenteric go into your large and small intestines, into your stomach. Femoral go into your upper leg. Popliteal behind your knee, and tibial arteries down on your lower leg, around the front and back of your lower leg, like your calf and your tibia, your shin. Anastomosis, Anastomosis, the junction of two or more vessels supplying the same body region. It's an end-to-end joining. So like going across from one artery to another artery, they kind of link each other going across. And collateral circulation, the alternate blood flow of an anastomosis. You see that not only do they cross from one artery to the other, but they also supply the same body region. So both these arteries are going to supply the same body region, and they both connect to each other. And when they connect, they form the capillary beds in between them. Arterioles. Arteriole means little or small artery, and they're going to be branches off of larger arteries. So your definition here, small arteries that deliver blood to capillaries. Here's a capillary bed here. The tunic's changed to a layer of endothelium and a few smooth muscle fibers. Here are the smooth muscle fibers here on this arteriole, and this side's uncovered, but you can see it's over here. You can see some of that. So you do see the smooth muscle covering the arteriole. Can vasodilate and vasoconstrict because of these smooth muscle fibers. Now capillaries, a single layer of endothelium. You don't see any smooth muscle around these. This is just endothelial lining. So when endothelial lining is by itself, that's called a capillary. Their primary function is to exchange gases and nutrients between the blood and your tissues, deliver that oxygen and nutrients to your tissues and pick up waste materials and carbon dioxide. I gave you some areas where there are many in muscles, the liver, kidneys, lungs, nervous system, and very few in the tendons and ligaments, none in the cornea and cartilage, because cartilage is dead tissue, and the cornea is avascular, just like the lens of the eye is avascular. There's a very large surface area for exchange of nutrients and gases. Yes. Now, when we were talking about capillaries, the true capillaries meander. They wander around. You know, they wander around before they go from one side to the other side. They wander around. But your next blank is called a meta-arteriole. M-E-T-A-R-T-E-R-I-O-L-E. Now over here on the left it says meta-arteriole. Serves as vascular shunt when precapillary sphincters are closed. Okay, well, a meta-arteriole just goes from one side to the other. Like it says a thoroughfare channel, that's a meta-arteriole. It does not wander. It goes from one side of the capillary straight to the other side of the capillary. Precapillary sphincters, and there it is on your picture also. P-R-E-C-A-P-I-L-L-A-R-Y. Second word is sphincter. S-P-H-I-N-C-T-E-R. Sphincters are circular muscles. So they're circular, and when they contract, they close off the opening. They close an opening because they are circular and the opening is reduced or closed. It says controls blood flow to capillaries. Okay, precapillary, that means before the capillary. So it's a sphincter before the capillary bed, and there's the capillary bed right in the middle. So it can control blood flow from the arterial side to the venous side of the capillary bed. True capillaries, this is true. Meander, that means they wander around. They don't go straight from an arteriole to a venule. So they're going to come out and they're going to wander around and eventually make it to the other side. From the arterial side, they kind of wander around and they eventually make it over to the other side. Now, there's a difference between some types of capillaries, continuous and fenestrated. And I have a picture of fenestrated here. Fenestra means pores. So you have continuous capillaries have no pores. They don't have these openings here. So continuous is just C-O-N-T-I-N-U-O-U-S. Well, fenestra, the word actually means window, but we use it as openings here. So fenestrated, Fenestrated capillaries have pores. Okay, so you see they call them, let's see, fenestrations or pores. So you can see they point out some on the right-hand side, but if you look at the left-hand side, you can actually see them in that capillary. You can see the holes there, the pores. Have pores for proteins and fluids to pass through. Examples of areas that have fenestrated capillaries: the choroid plexus of the brain and the eye are two good examples of fenestrated capillaries. They're also in the kidneys for filtering your blood. Now a sinusoid, sinusoid, small blood vessels that are larger than capillaries. They're found in the liver, spleen, parathyroid gland, and adenohypophysis. That's the anterior lobe of the pituitary. They're lined with phagocytic cells and convey blood from arterioles to venules. We'll see a sinusoid when we get to the digestive tract. Venule. A venule is V-E-N-U-O-L-E, is from capillaries to small veins. So over here, we see a venule right here on the right-hand side. From the capillary bed, that venule is going to build into larger veins. And so we have veins as your next word, V-E-I-N-S, carry blood toward the heart, contain valves to keep blood moving toward or flowing toward the heart. So veins in your extremities have valves. A vein will collapse when cut, composed mostly of fibrous tissue, and the blood pressure is kind of low in veins. So let me look back up here. Let's look up here at this picture right here. And you see these valves? These are valves in the extremities. So veins in the extremities have valves, and they are semilunar valves. See, the valves are up, pushed against the wall here, the top, and at the bottom, they're ballooned out, so the blood can't go backwards. So veins in the extremities have valves. Now it says, you have two blanks, blank and blank, aid venous flow. Well, one of those is breathing. So I'll put this on here. This is your thoracic cavity. And to breathe in, you see air going in, increase the volume, it decreases the pressure. So as this diaphragm, this structure on the bottom is going down, the volume is increasing and the pressure is decreasing, and you inhale. And we'll talk more about this when we get to respiration. When you exhale, the diaphragm domes up. It's a relaxed position. The volume decreases, the pressure increases, and you exhale. So breathing will have an effect on the veins in your thoracic cavity by sucking and pushing down on them. So when it sucks on them, they balloon up and fill with blood. And when the pressure in your thoracic cavity increases, it forces that blood into the heart. Well, here is muscle contraction. This is why like in nursing homes, or in places where someone's in intensive care, they'll come in and move their arms and legs a little bit to keep the blood moving past these valves in the extremities, and it moves the blood toward the heart. So that's so that blood doesn't pool. They'll cause muscle contractions by bending the legs and straightening the legs and bending the arms and straightening the arms to force the blood past these valves and move it toward the heart. Your pulse, force of the pressure in arteries caused by the ventricles contracting. Approximately 72 to 75 beats per minute, that's your pulse. All arteries have a pulse, and I've given you some areas you could look at to see what you could think about to see where pulses are in the body. Temporal, carotid, facial, brachial. The one that you probably do the most is the carotid in your neck or the radial in your wrist. Those are the ones you can feel pretty easily. Blood pressure, the amount of pressure on the walls of the arteries. That's what your blood pressure is, the amount of pressure on the walls of your arteries. So systolic pressure, we talked about systole earlier in a previous chapter. So systolic pressure, the measurement of the force of the blood being pumped by the left ventricle. So when you take a blood pressure and you get that 120 reading, that's the high reading, and it's the result of the left ventricle forcing blood out of the heart and into your aorta, and the closest place we can record is your brachial artery in your arm. That's going to be your systolic pressure. Just think of the left ventricle squeezing and systolic, when it contracts. Diastolic pressure is your next blank, diastolic pressure. It's the recoil pressure. The ventricle is in a relaxed state. It's a measurement of the resistance pressure in the vessel. This is so when the left ventricle contracts and the artery swells, that's the 120. And when the ventricle relaxes and blood tries to come back into the heart, some of that blood has been forced into the body, and so the pressure is going to be less. And so when the semilunar valve slams shut, that's going to be your diastolic pressure. Arteriosclerotic plaque materials in the vessels will increase the diastolic pressure yet. It takes up space, and it won't let the vessel expand and recoil like it should, so the pressure is going to be higher in the vessels. Pulse pressure is the difference between systolic and diastolic pressure. So pulse pressure, that'd be like if you had a normal or average blood pressure of 120 over 80, the pulse pressure is going to be the systolic, the 120, minus the diastolic, 80, which is 40. So the driving force is 40 millimeters of mercury pressure that keeps blood moving into your body. Varicose, V-A-R-I-C-O-S-E, veins which have lost their elasticity due to weak valves. So you see on the left-hand side, the valves are good, and they close to prevent blood from going backwards. So they'll open, let go forward, and then they close so it can't go backwards. Well, look at the one on the right-hand side. The valves are not working anymore, and blood pools, and it kind of swirls in those vessels. Blood pools and fluid collects in the surrounding tissues. Now, these are going to be superficial veins. These are going to be ones like between your skin and your muscle, because deeper veins are aided by skeletal muscle, and that gives it support around that vein. So deeper veins are aided by skeletal muscle and don't varicose. Okay, the superficial ones are prone to varicosing. The deep ones, not too prone at all, because they have muscle around them which supports them from expanding any, being stressed. Now, hemorrhoids, Hemorrhoids, varicose veins of the walls of the anal canal. Remember, those are superficial. And so if like you strain too hard to go to the bathroom, you could put a lot of pressure on those veins and they could varicose, they could billow out. And childbirth does the same thing. You can give females hemorrhoids from childbirth, from straining to push to get the baby out. Now those can be fixed, those can be removed, so you don't have to worry too much about that, actually. Now we have arterial. Blood pressure is affected by some things that will affect your blood pressure. Number one is cardiac output, the amount of blood pumped by the left ventricle per minute. An increase in stroke volume or heart rate will increase the blood pressure. And that's pretty obvious, right? If you increase the amount of blood leaving the heart per minute and the number of beats that the heart beats per minute, you're going to get more blood on the arterial side faster. Number two is blood volume. Blood volume. A decrease in blood volume will lower blood pressure. That'd be like a hemorrhage or a big bad cut where you bleed a lot. You're losing fluid pressure. You have less fluid to pump through your cardiovascular system, so your pressure is going to drop. High salt intake results in high water retention and an increased blood pressure. So you can also have an increased blood pressure if you're very sensitive to salt concentrations, and then some people are just set for high blood pressure genetically, as well as set for low blood pressure genetically. Number three is peripheral resistance. P-E-R-I-P-H-E-R-A-L Second word is resistance, R-E-S-I-S-T-A-N-C-E. The resistance to blood flow. Now, things that affect that, the viscosity, how thick is it? Thickness, more friction. The diameter of the blood vessels, large versus small, and the length of the blood vessels. Try going outside and blowing through a 50-foot water hose and compare that to a Viva towel cardboard tube. You notice there's a big difference. They have different diameters and they have different lengths. And so that's going to affect resistance, as well as viscosity, how thick that blood is. Some people's blood is actually thicker than others. Looking at something that we were looking at previously, or talked about previously, here are your arterial pulse locations if you were looking for those. Okay, you can see where those are in the body. There's your carotid I talked about in your neck and your radial and your wrist, but there are other areas of the body that you can feel blood pressure. Control of blood pressure. Let's see, I have this over here. Response to activity. You can look over this, but you have the vasomotor center in the medulla, which we will look at a little bit more when we look at the respiration. And we looked at some of this in the heart part of our lectures. In the medulla, there are baroreceptors or pressoreceptors, are the same thing. So baro is B-A-R-O-C-E-P-T-O-R-S in the aorta and carotid sinus and vena cava and several other places, if you remember, that monitor your pressure. And so your vasomotor center in the medulla will either increase or decrease the rate of your heart beating. Chemoreceptors in the aorta and carotid sinuses, those are going to monitor chemicals like gas levels, like oxygen and carbon dioxide levels. Higher brain centers control blood pressure by the emotional state. You know, when somebody is really, really upset, you can see them turning red. Well, their heart's beating faster, their emotional state is driving that, and their blood pressure is higher. Chemicals can cause vasodilation and vasoconstriction, like epinephrine, norepinephrine, acetylcholine. Those can also cause changes in blood pressure. So you can read through some of this and see how your body responds by these baroreceptors and chemoreceptors on this picture.